Hi, I'm Dr. Jonathan Craighead. This is a short video about outpatient knee replacement surgery. One of the important things during this process is that you identify a family member or a friend that will act as your coach or support system. This person will bring you home on the day of surgery and stay with you for a few days afterwards while you're recovering. We would ask that you have that individual watch this video with you. The most common reason for knee replacement surgery is arthritis. Arthritis is a medical term for destruction of the cartilage or cushion between the bones. As the cushion wears down, you get bone on bone, which causes pain and stiffness in the knee. You can see in this x-ray a normal knee that has good space between the two bones. Contrast this with an x-ray of an arthritic knee where you see that space is gone and you now have bone on bone contact. Here we see an x-ray of a knee after joint replacement where the anatomy has been restored and the space is once again seen. The surgery itself takes about an hour. During the surgery, we make an incision over the front of the knee. If this is the thigh bone and this is the shin bone, we actually take the edge of the bone and we remove the arthritis. And then we cement a metal cap onto the edge of the thigh bone. Similarly, we remove the arthritis on the top of the shin bone and cement a metal prosthesis there. Between the two metal pieces is a plastic spacer. So now, instead of rubbing bone on bone, you have the metal rubbing on the plastic. This gets rid of the arthritic pain. It's important that if you are allergic to metal, jewelry, or nickel, that you let us know immediately so we can make sure that we get the right prosthesis for you. The risk of surgery is low in healthy individuals. The risk of infection is less than 1%, and we will give you IV antibiotics during your surgery to help prevent infection. The other risk that you need to know about is potential for blood clot. If you have a history of blood clot or are at high risk for a blood clot, we will start you on a prescription blood thinner for at least a month afterwards. If you do not have a high risk for blood clot, we will ask that you take a baby aspirin twice a day for about 40 days. The risk of nerve damage down in your foot or ankle is way less than 1%. Almost everybody that has a knee replacement surgery will get a little dull or numb spot on the side of their knee afterwards. Sometimes this is permanent and sometimes it goes away. It doesn't usually bother people, but we like for you to know about it. The other important thing to realize is that the new implant is a harder surface. Occasionally, patients may feel a click or hear a click in the new knee. This is the metal hitting the plastic and is completely normal. It does not mean that the prosthesis is broken or coming loose and is to be expected. We will have you wear compression stockings after the surgery during the day for about a month afterwards. This helps with swelling and also helps prevent blood clots. You do not need to sleep in these stockings and you may wash them. The other thing that you need to know about is there is always a risk of stiffness and abundant scar tissue afterwards. Very rarely, people will lay down so much scar tissue that it has to be manipulated or broken up later. This is rare, and it is also important that you do your physical therapy to help prevent this from happening. In preparation for the surgery, there are a few things you can do to get the house ready. We would ask that you remove any clutter, loose cords, or rugs that you could potentially trip on. You will need a walker after the surgery that you will need to bring with you on the day of the procedure. If you don't have a walker, my office will be happy to get one for you. We also would recommend an elevated toilet seat if you have a very low commode and have difficulty getting up and down from the toilet. Another item that some patients like is a shower chair. If you're concerned about having to stand in the shower for a long time, a shower chair may make it more comfortable for you to wash. These items are available at most medical supply stores or online. We also recommend icing the knee regularly after surgery. Ziploc bags of ice or bags of frozen vegetables work just fine, but if you prefer, we can arrange for you to purchase a Polar Care machine or ice chest machine either from our office or online. Just let us know. After surgery, you will be able to put all of your weight on the leg, but we will have you use a walker for balance. Physical therapy is a very important part of the recovery. We will have you do 1 to 2 sessions of physical therapy prior to your surgery. At this visit, the physical therapist will work with you on how to appropriately use the walker, give you some home exercises, and also instruct you on how to do stairs. After surgery, a physical therapist will come to the house within 48 hours of the procedure. Typically, they'll come out to the house once or twice a week for about 2 weeks. At this point, you should be ready to transition to outpatient physical therapy. Most people will do physical therapy twice a week for 6 to 12 weeks after the surgery. Prior to surgery, we would ask that you obtain medical clearance from your family doctor or cardiologist. It's important to have them evaluate you and make sure that you are safe and healthy enough to have the procedure. We would also ask that if you have not had a dental checkup in the last 6 to 12 months, you see the dentist and make sure there's no infection. Sometimes there can be bacteria in the gums or around the teeth that can get into the bloodstream and cause an infection after joint replacement surgery. Please have the medical doctor and the dentist send these clearance letters to our office. This can be done via fax or mail. After the surgery, we would ask that you not try and drive until you're off the narcotic pain medicine. If it is your right knee that is replaced, you need to be walking with a safe, normal gait and have normal reflexes prior to driving. We don't have a set date that you have to return to work. On average, people will take off about a month, but we want you to feel safe and comfortable before you return. If you have any questions about work or need any paperwork filled out, please let us know. Approximately 2 to 3 weeks prior to surgery, we will have you do some lab work. We are also going to have you meet with our anesthesiologist and go over the procedure. You will have a preoperative nerve block which will help with your pain afterwards the morning of surgery. We almost always do the surgery under a spinal anesthetic, and the anesthesiologist will go over this with you. Post-operatively, you will be in the recovery room probably 2 to 3 hours afterwards. We will make sure that the spinal has worn off and that you are able to stand and walk comfortably and safely. We will also make sure that you are stable and your pain is well controlled before letting you leave. It's important to have reasonable expectations for your surgery. While the surgery does get rid of the arthritis, it's normal to have some pain and swelling afterwards. Your pain should be well controlled with the medication which we will call in for you. This medicine will be sent to the pharmacy of your choice approximately 1 week prior to the surgery. While the surgery does get rid of the arthritis, it doesn't make you 18 again. You still have soft tissues, including the bursa, tendon, and ligaments. These can become inflamed and painful during certain activities. Most studies have shown that knee replacement surgery has a favorable outcome approximately 85% of the time. Historically, our outcomes have been much better than this. It's important to us that you feel safe and comfortable throughout this process. If you have any questions or concerns, please do not hesitate to contact us. We will be sending you an additional video the day before your procedure and the day after that we would like for you to watch as well.